Assalamu alaikum. Good morning, good afternoon, everywhere in different regions of the world. My name is Aisha Khalid. I'm the VP Alumni in STM USA. And today we are bringing you the second webinar from the webinar series we decided earlier last year. We are going to take you and help you with your different challenges while balancing your work life day-to-day challenges which you all face as engineers. Today we have Dr. Sitwat Malik. She's going to have a conversation around anxiety, and she's going to first educate us around anxiety and different challenges which we all face. She's a board certified psychiatrist. She's a resident of St. Louis, Missouri. She lives in St. Louis with her husband and a daughter. She has two daughters, mashallah, and she specializes in addiction, integrative, and adult psychiatry. She believes in a holistic approach to patient care, addressing emotional, physical, social, and psychological aspects of each individual's well-being. So I'm going to now hand it off to Sitwat so she can take on forward from here. Thank you, Sitwat. On to you.
Assalamu alaikum, everyone, and good morning and good afternoon. Thank you so much, Aisha, for the introduction, and thank you, NUS team, the whole team, for having me here. So today we are going to talk about anxiety. So first I'm going to give a little bit like overview about anxiety, and then we will move on to the questions. So I have like few slides, so I'm going to share my screen. So first we can talk a little bit about anxiety. Please let me know if you are able to share, see my screen.
Yeah, we can.
Okay. All right. So basically, so what is anxiety? Anxiety basically is a feeling of worry, unease, nervousness. It is unpleasant, feeling of apprehension, and it gives you tension. Basically, those are the worried thoughts of which source is usually not known or like almost always not known. So the question is, can anxiety be a good thing? Yes, definitely. It is a good thing. It is something which we all experience, and it provides us motivation to get somewhere or to achieve something. So when we have some exam coming up, so and we are anxious, so our anxiety will make us study. Or if we have some project due, or if we want to perform well at our work, so we would like to do better, and this anxiety will keep us going. So yes, definitely it is like a positive catalyst for our brain which keep us going. And it can improve focus for the same reason what I just explained. So but anxiety, it may be or it can get abnormal. And when we consider it abnormal, when usually it is out of proportion to the situation that is creating it. Meaning the situation or fear is small, but we are just like feeling it totally out of proportion. And when individual finds it difficult to control the worry, you are trying your best, but it's still like you cannot control it. You are anxious, you keep thinking about it, and then it interferes with your social, occupational, and other areas of your life. So, and anxiety, it is one of the main presenting symptoms of many of the psychiatric disorders or medical or psychiatric conditions, as well as other medical conditions also. Anxiety disorders. So those disorders are basically psychiatric conditions with excess anxiety, which affects functioning. Those are intense, excessive, and persistent worry about every day. And those are about the very small things. It is strong enough to interfere with daily functioning also. So basically what happens, so the main part of our brain which is involved with anxiety is amygdala as well as locus ceruleus. So what happens, those part, especially amygdala, it is connected to other parts of the brain also. So when there is too much anxiety, so even with like little bit of anxiety, it is connected. It gives you the similar symptom I'm going to mention. But when it is like too much or out of control or like constant anxiety, then it keeps stimulating other parts of the brain also, which it is connected to. That includes those parts which control our breathing, which controls our blood pressure, heart rate, muscles. Those all are also connected to amygdala. So those all are also elevated. And the main neurotransmitter which are related to anxiety, those are serotonin, norepinephrine, GABA. Those are the main neurotransmitter. So I'm trying to keep it a little bit simple, but those are the important things I still have to mention. So those neurotransmitter plus like stress related hormone is cortisone, which is also related when we are stressed out. So these all, when they are like constant, that can cause disorders, or that can cause a problem which is like hard to manage, and then it is like out of control and you may need treatment for that. So yeah, next slide. So fear versus anxiety. So there are few terms which we usually use interchangeably, like fear, anxiety, stress. There is a minor difference. There is a difference between those, but there is a minor difference. But usually, commonly, they are used interchangeably. So fear basically is a response to something known or external, definite threat, something which is actually there, like you are in a zoo and lion just get out of the cage. So that's actually a threat. So that's fear, I would say. Then anxiety, although you are anxious also, because then there is a fight and flight response. I'm sure like everyone heard about this response. So that also is involved. But basically what anxiety is, it is the response to the threat that is unknown, or like a little bit very small threat, but or maybe like it's like a spider and you are taking it as a lion. So it is out of proportion, or it can be unknown or internal. So that is also important. um, Internal, vague, or unknown. So what are the causes? So there are variety of things like which can cause anxiety, or especially like when it is a disorder. So caused by combination of biological, psychological, and social factors. It may develop from major stressors such as death of a loved one, divorce, or loss of a job. They also appears to be a major genetic component. So, what this tells us, so obviously, as we just like read, that there is a strong genetic component in that way, without any reason, you just get it. You just get as a inheritance. That is possible. But someone get into accident, someone get into like some trauma, they have PTSD, or they get divorced, some like real stressor. So now you can have new onset of anxiety disorder. So it can happen at any time in your life. So usually it is associated with restlessness. You may feel on edge. You can be easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbances, elevated heart rate, difficulty breathing. Those are some of the physical symptoms. Chest tightness. Um, People may present with memory problems also. They may feel like they start having early dementia. That is also very common presentation. Even like young people, they come to us in 30s or 40s, like I feel like, oh, I'm having like early dementia, because that can be because of this difficulty concentrating or mind going blank. So it can present in various ways. GI upset, it can cause so many things, physical as well as mental. Sleep problems. Then type of anxiety disorder. There are many anxiety disorder or types: generalized anxiety disorder, panic disorder, specific phobias, agoraphobia, which is the phobia of either closed spaces or open spaces. People may have a fear of going in public, like big groups, or in like small or closed spaces. Both comes in under this. Social anxiety disorder, separation anxiety disorder, selective mutism, obsessive compulsive disorder, and post traumatic stress disorder. So those two, obsessive compulsive disorder as well as PTSD, they comes under anxiety disorder, but they themselves are like a huge big separate category. So the most common overall worldwide, so those number, those prevalence rate percentages are for United States. But overall, worldwide, the most common is a specific phobia, meaning these phobias are like the phobia of flying, phobia of fire, or like in our Desi community, very common phobia of like animals, dog, lizard. Yeah, so that is very common for us. So, and we don't even take it as a problem. We just like, oh, this person is just scared. But actually, it comes under a specific phobia, and it is very treatable. Uh, so yeah, so that is the most common phobia worldwide. Then comes usually generalized anxiety disorder. People live with those disorders for their whole life without knowing. Even generalized anxiety disorder, they live with their those with their whole. They live with those disorder for their whole life and without knowing that it is treatable. And treatment can be simple. It is not always very complicated, but depends on person to person how much treatment you need. So it is always better to address those. So some other points about anxiety is that anxiety is the most common psychiatric disorder in United States. I'm not talking about anxiety symptoms. I'm talking about overall those anxiety disorders, which I just mentioned about those types. Um, they are more common in women as compared to men, but is still pretty high number in men also. I did not mention the prevalent rate. If I'm right, around like 5 to 7% in women and 3 to 4% in men, but it's still like pretty high number in both. It can occur in children, and it is present in children in many different forms. And we look at like children as like they are like cranky, they are just like, not in good mood all of the time, they just don't listen or they don't sleep. Those all are like they're very irritable, angry, fight or argue about everything. Those can we can see commonly around kids, in kids around us, but that can be the sign of anxiety or even depression. So those are some alarming sign for that. Those anxiety disorder, they are associated with significant morbidity. It can affect your functioning. Young, like even high school kids, college kids, they can drop out of college or like drop out classes. They keep failing classes because of that. People lose their job because of anxiety. So anxiety disorders are like often chronic and can be resistant to treatment. May not seek treatment, as I just mentioned. So many people around worldwide, including United States, they just don't seek treatment because many of the people, they think that's how our personality is. But it actually can be some of the disorder. And good thing is, it is treatable. It can be treatment resistant, but not very often. So good thing is it is treatable, and people does not have to suffer. So if like need to, we should get treatment. So we are going to discuss few of the practical things initially, which we can try like during the presentation, and like with the questions, we will address those topics. So there are things like which we can address by ourselves. And like if like obviously we are not able to manage by those things, like then definitely we need professional help. So yeah, before we go to questions, I would like to say one thing, that there is a famous saying about anxiety, that anxiety is just like a rocking chair. It gives you something to do, but it definitely does not take you anywhere. So that's how anxiety is. Okay, and then I'm going to stop sharing. Are you guys still seeing my screen or?
We can see you perfectly fine.
You can see me?
Yep, yep.
Okay.
You're,
All
yeah,
right. All right.
yeah,
So now we can start questions.
yeah. Thank you so much. That was really informative. All the information you shared really makes sense. Because earlier I felt like it's anxiety. It entails more than that. Um, Thank you so much for explaining. So we did collected some questions from our alumni. The first question, which I would like to ask you, is that what are different treatments available for anxiety? You did touch some of the different types and all, but if you can share with us, how do you treat patients who have extreme anxiety?
Yeah, sure. Sure. Thank you, Aisha, for the question. So, yeah, there are multiple different options available. And as I just mentioned, it depends on anxiety disorder, it depends on person to person, how we need to treat. So, some general treatment options are usually like we combine two of the different treatments. So, one main treatment is individual psychotherapy, and the other are the psychopharmacology medication options. So, speaking of individual psychotherapy, we have supportive psychotherapy. The main big one is cognitive behavioral therapy. Then we have different relaxation trainings. We have meditation exercises, breathing exercises are very commonly used. Then there is mindfulness. So those all are the different psychotherapy options. And especially like cognitive behavioral therapy, it has a lot like multiple parts, and it usually takes anything between 8 to 16 session, again depending on person to person. And then we can just like have follow up or like maintenance sessions. Other than that, like psychopharmacology, so there are different various medication options. Some are scheduled, like you need to take it every day. Some are just as needed when you are like severely anxious. So then you can use those. And those are some anxiolytic medications, antidepressant medications we use for anxiety, because like the neurotransmitter serotonin that works for, so those medication, they work on the receptor in brain. Those receptors are for anxiety as well as depression. That's the main reason we use those antidepressant for anxiety as anxiety medications also. So other options are antihypertensive medication. So those we use for physical symptoms, just like, some are going to present, like someone has like college presentation or like presentation at work and they have like severe anxiety for that. So there are some medicines which are antihypertensive, but we give it in low dose to give like to control that situation. So we just only use it for that. Then there are some antipsychotics also in very low dose. They help with severe anxiety. Gabapentin, which is basically for pain, but that it also has anxiolytic property. So there are different medication options. Plus, one of the big one is exercise. So, and exercise can be as simple as like daily walking. You don't have to do cardio for that. Daily walking, especially outside, fresh air, exercise has great benefit, very important for any of the anxiety disorder as well as for depression. And for all of the mental health problem, exercise is big. So those are some of the options.
Thank you so much. That was a lot of information. I think I have to go back and listen to it again so that I capture everything. So one quick question, and then I will pass it on to Tatir, and she has more questions. You did mention about meditation and some breathing exercises. So does that mean yoga and some of those exercises help you with anxiety?
Absolutely, a lot. So we need to find out what works for you. If yoga, you are a yoga type person, yoga works for you for sure. It does help a lot. So those are like, some like integrative side or just like, the part of therapy. In fact, like when you do therapy, those things are discussed. If you like yoga, if you like some of the breathing exercises, meditation, including meditation music. So we do have so many different options which you can use on day-to-day basis.
Oh, thank you so much. Tatir,
Great answer, Dr. Sitwat. So my next question would be, how do you deal with day-to-day anxiety, especially when you're triggered at workplace, and how do you balance out your act?
Yeah, that is, I would say, a very important question, and that is the main point of today's talk. So I'm going to talk a little bit detail about this because my goal is to discuss like some of the practical options which we can discuss, which we can actually use um, on daily basis. So that is again like as the main reason of why we are here today. So first and most important, before like I can go towards like the formal or official guideline, I would like, so this is like not the main guideline, but this is the part of different therapy, or this is what like we recommend when we see people for anxiety. And that is, please stop multitasking. Yes, that is very important. I'm sure everyone is like, what? Like, when people multitask, it sounds like, or it counts as a smart person. You look cool, you look like a smart person, an intelligent person, you can tackle so many things. But please don't do that. So our brain is not structured that way. It is not made to do multitasking. When we multitask, we feel that, oh, we are being very productive, we are multitasking, we are covering so many things, and we are saving time, but actually we are doing opposite. So what happens when we try to multitask? We basically are like juggling our brain. Our brain is just like, literally that's how brain feels. So we shouldn't be doing it, and it actually affects our focus. So let's say like if I'm talking to you guys right now and I'm like try to check my text, which is the most common thing we do, or like see email or see like, oh, if this person is here, like if you are in office, I'm just giving different examples. So basically, we are giving trouble to our brain. We are not focusing. And if like, so I'm giving mostly like I'm mentioning lectures or like, job, because like mainly we need to like address this for early career professionals or like young professionals, although we can apply all of those things which I'm going to mention for literally everyone, including teenagers, adults, older people. We can apply it to anyone, but I'm giving example, uh, keeping those people in my mind. So multitasking, what it does, like it affects your focus. So you don't focus, so you don't develop memory. So if you are attending a lecture, so you are listening but you are like not actually making a memory. It affects your executive functioning, your memory, because you are not concentrating, your focus is poor, and then it starts affecting your cognition overall. It starts affecting your memory. And so that's why like this is one thing we should not do, and it distracts us from so many things. So instead of being productive, we can be productive in a moment, but actually you may end up like not being that much productive. You may have to go back to what like you were doing at that time and see again like what, oh wait, what it was. So it is hard, it is very hard, especially these days. And multitasking does not only include when we are doing something productive, like when we are listening to lectures, or when we are in a business meeting, or listening, learning, or not only for that. When you are watching TV, you that's like simply relaxation time. We all, I'm sure almost all of us, what we do when we are sitting in front of TV, we also have our phone in our hand, and we are either replying to emails or replying to text, or like checking something on Instagram. So we all do that. Even that we shouldn't do. So if you are watching TV, just watch TV, just like old school or like old style, when we didn't have like smartphones. We used to just watch TV, just like listen to music. And that even includes like when we are driving, although I would like little bit debate over that. Like when we are driving and we listen to lectures, we listen to music, we talk to people over phone. So even that is like been said, like you shouldn't be doing that. Although I would like doubt that, or like little bit like, that is definitely a little bit, productive. So, but in short, we should avoid it as much as we can to improve our concentration, or like to avoid day to day anxiety. We all are anxious. As I said, this is natural. Everyone is there. There is no way any human being who does not been anxious ever, or like even on day to day basis. But if we keep doing, or keep being multitasker, so then we start affecting our anxiety, or it can keep get worsening. So that is the main point. So now, like, the main guidelines, or like what all we can do practically on day to day basis, is one of the big one is breathing exercises. So there are different ways, like, although we all breathe, but when we do it to relax ourselves, there are certain ways. So during therapy, usually we tell it we don't have enough time. Otherwise, I would have tell. So it will take a long time if I start telling. But like, simply, I can tell you, or you can search, even like on YouTube, for the proper breathing exercise by like some proper like yoga trainer, or some like personal trainers who are on. So like something like who has like little bit better knowledge. But it is as simple as breathe through your nostrils and take out from your mouth. It can be as simple as just relax, sit, not while watching TV, or not while seeing your phone. Just like sit, relax in some like calm place. You can do it in your work, like workplace, office. Just like by sitting here at chair, like if I'm getting overwhelmed, my day's not going good, I can just like sit here for a few minutes without any interruption, and I can do breathing exercises for literally few minutes. It helps with anxiety tremendously. It is like one of the big thing which can instantly help you calm down and focus more, or again, like, prepare you to go back to the same stressful situation. So that's one of the big one. Then mindfulness, basically what mindfulness is: living in a moment. Whatever you are going through right now, just present there. Don't think about, oh my god, this happened yesterday, or like, this person said this to me, that was mean. Or don't even think about like, oh, what I have to do like for dinner, or like, oh, I have to do this and that. Obviously those all are important, but what we need to do, we can like keep calendar for that, or set like 100 alarm. You have phone, like, you can set so many alarms on your phone. So if your phone can do the work, let it do the work, instead of like your brain like keep reminding, like, yeah, 6 o'clock this, and like 8 o'clock this, I have to call this person. Again, that all is important, but if you are present in a moment, and that is a little bit part of like avoiding multitasking, as I just mentioned, that can be taken as like the similar thing. But basically, if you are in a meeting, or listening to a lecture, or talking to someone, even if you are at dinner with a friend, like Friday night, and it is just like supposed to be relaxing, so just be there instead of like doing something else or thinking about something else. Enjoy that moment. That definitely helps and relax our brain, and that helps with anxiety. So and like some other things which I can talk about is like, go for the basics. Basic things are very important, and that includes like good sleep hygiene. Sleep is like, again, huge topic, the whole separate topic, very important. Sleep is very, very important for us. If you are sleeping better, with not only like more hours, but I'm talking about sleep quality. So if you're sleeping better, that can help with anxiety, depression, concentration. You will just feel better. Next day, you will be in good mood. You will have better energy. So sleep is big. If you slept well last night and today you have a lot of stressors, you can deal with those stressors definitely in a better way. But if you already had poor night's sleep, you are already miserable when you get to work, and now like you have so many things over there, you will be, really anxious. You will not do good. You will just be like, overwhelmed. So sleep is definitely very important, and like one of the main basic ones. So talking about basics, good sleep, you can do good sleep hygiene, plus I would say healthy eating, exercise. So all of the good healthy habits, or like all of the basics, those all are also very important to manage your day-to-day anxiety. Then there are some, I hope like I'm answering what you asked for, right? This is relevant. So then there are, okay, okay.
I'm like
So
all the culprits of this, doing what what you just explained, multitasking and all. So we are taking note, all good notes for ourselves.
okay, good, good. That's good then. So then, like, I would like to address some of the integrative option, because like integrative part of psychiatry is also my area of interest, because I feel like when you have any of the mental health problem, then we need to approach that person as a whole person. Overall in psychiatry, we cannot just address like, oh, you have psychosis, okay, just do this, take this medicine and you will be fine. We cannot do that. um, but overall, like the integrative part is like basically approaching that person as a like overall, not only medications, not only therapy, but the other parts, like natural things also, through which we can help. There are so many natural products you may see like over the counter, or you may have heard from someone in your family, oh, if you are like stressed out, like just drink this tea, or like take this. So this is what I'm talking about. So many of the herbs, like I wouldn't say like just see whatever you find over the counter and start taking it. No, please don't do that until unless you do the research, because it can be something like negative, or it can affect your body functioning, or it can also affect your other medication. So many of the herbs, they interfere with, if someone has hypertension and they are taking some medicine, if someone has hypothyroidism, so that can interfere with those medications. So please definitely avoid just getting anything random. What I would like to mention here, which you can actually use, which is safe. We actually have so many researches on those, and you can start taking it if you want. Those are especially like one of the main one is magnesium or magnesium. So whatever like we can call it. It's like, so magnesium is we can take as a food supplement, just like multivitamin. So that one is very good for anxiety, stress, sleep. It is called to help with depression also, but like we don't have enough researches or enough support. People use it for depression also, but for sure anxiety, sleep, some other psychiatric condition also. But like regarding our topic, I would say those are the two most relevant. So, and you need to take it at bedtime. You can take literally 100, it is available usually in 100 milligram capsules. So 1 or 200 milligram an hour before your bedtime, you can take it regularly. It helps with so many things. It relaxes you. It overall improves concentration. It helps with better cognition, better focus. And again, sleep is very important. So without taking any sleeping pill, you can get help. Just like melatonin, which is like, is producing in your body. Anyways, you can get it for sleep without going towards the medication direction. So it is same as magnesium, but magnesium obviously has a lot more benefit. So magnesium 100 to 200 milligram an hour before bedtime, you can take for anxiety. On day-to-day basis, you can take as needed, you can take every day, both are fine. Excuse me. Then some other is like lavender. So lavender, we can even take orally, and we can take as a, oil, lavender oil. So lavender oil, usually it is available like in a roll-on form. If you're really anxious, and especially anxiety, it affects your sleep in the middle of the night. So let's say you woke up in the middle of the night and now you have like all ruminating thoughts going on. Excuse me, let me drink some. I have a little bit itchy throat. So that's what I was just like worried. It can get itchy during our talk, but it's not too bad. Excuse me. So lavender oil. So as I said, like if you wake up in the middle of the night, so then you can like just use that roll on your temples, or like on your pressure point behind the ears, or on your neck. It has like very good smell, pleasant smell, that can help you, and it relaxes you basically. So you can use that. So if you are awake in the middle of the night, especially because of anxiety, because that is very common presentation of anxiety, that you cannot either fall asleep, or otherwise if you wake up, then you cannot back to sleep again, because you're constantly thinking about your worries, or your fear. You are thinking about that. So just put on eye mask and do the roll on and try to sleep again. So that can be helpful with anxiety. And then we have like oral lavender tablets available. You can take that also if you are anxious. That does not make you sleepy, so you can take that during the daytime also. We have some other which are not very commonly used but possible, like lemon balm. We have ashwagandha. Those type of things are commonly used like since like ancient time for anxiety. So obviously, marijuana is also very commonly used for anxiety, but I would like say it is like legally approved, or medical marijuana is also there. That's a huge topic, but I would say that is helpful, but that helps in short term. There are so many drawbacks in longer run. It affects your memory, it affects your cognition, it actually starts worsening your anxiety. So we should avoid those anyways. But like for those reasons, what I just mentioned, I would not, because people these days are very commonly using marijuana or CBD for anxiety, but we shouldn't be doing it. Not advisable, I would say. All right. I tried to cover many of the small things or important points or practical points. Any questions regarding that? What all I just said?
I think you
We are,
covered most of it.
yeah, we are getting a lot of questions on the side. I would just take this one in, and then sit with we. If we have some more questions, probably we will request for more time from you, because this seems like a very interesting topic with a lot of questions I'm getting from different channels. So we have one over here. If you can answer that, and then I will give it back to Tati. Um, so it's about, because it relates to what you just explained. So you did mention about being present in the moment and being focused as a solution to anxiety. However, it is not being able to do both already caused by anxiety. Could you expand a little bit more on ways to stay focused and not being zoned out? Like any practices we can do? Um,
Yeah. So if I got it correctly, so the question is like, if like it is, so if we are already anxious, then how can we do or practice mindfulness, right? That is the question.
so it's more like something we
Correct.
do to not be zoned out. Yeah. You want to?
Yeah, correct.
Something to do not to hold up. Yeah, go on.
That was the question, because both of these things I feel like they are interdependent, right? And not being able to focus on something and not being able to being present in the moment is
Mm-hmm.
already caused by anxiety, right?
Yeah.
How would you manage
Yeah.
that if you're already anxious?
Got it. Got it. Yeah. So yeah, those both of the situation can go interchangeably or vice versa. So we keep going in a circle, and that's what happens in anxiety. We just like a rocking chair, same place, or like we keep going in a circle. So basically, first, like for mindfulness, I briefly mentioned that, but like for mindfulness, we need to remove distractions. So let's the number one distraction again is phone, social media, that is linked to social media, even like emails, other things, text, like we are in so much pressure from so many things. So remove distractions from your surrounding. If you are making presentation, if you are studying for exam, or even if like you are cooking, I would say, because cooking can be relaxing for people, like they can use it as a like de-stress. Some people even get de-stress from cleaning. It depends again on person to person, whatever is your yoga, or like whatever is your listening to music. So what we need to do first, like remove all of the distractions. Don't keep phone with you. World can survive without you for 30 minutes. No one is going to die if you are not present to attend their phone or reply to them. They will be fine. So leave your phone outside of that room where you are sitting and trying to do whatever you are trying to do. So remove that distraction, plus some other distractions in the room if you have, like let's say if you have like some game sitting there. Gaming is one of the big problem these days. So any of the game which you can play or anything else. So in short, whatever you want to do, whatever you are focusing on, like you have one book, you are making presentation, close all of the windows from your laptop or your screen, whatever you are trying to do. So just keep that open. Even emails, those all are there on our desktop. So just close out everything, just keep that one, so you just only focus with that. And then remove your phone and try to, and this needs practice, this does not come overnight. So we all need practice for most of the things which I just mentioned. We need to do it. Mindfulness, present in a moment, or like being like not do multitasking, those all needs practice, and practice will make you perfect. So remove your distractions, and if that something specific is causing the anxiety, and that can be any person which is causing the anxiety, so I would say remove from the scene, either you move out or like remove that thing. So that is first and basic step to start with, and then find out what works for you. For some people, they still cannot focus when until unless like there is some background music listening going on. So if that is the case, so maybe you can set that on. So that can be the second step to help yourself a little bit more to stay focused or to practice mindfulness. Although listening to music for mindfulness is little bit like like you should do it or not do it, but I wouldn't completely say no to it, because if it is helping you, sure, like if it is helping you practice mindfulness, sure, do it. But otherwise, like overall, remove all of the distractions, then try to focus on the main thing. So that those are the basics, and again, find out as you keep practicing, you will find out important things for yourself, and it will make you more perfect, and then you will become quicker. So once you know more, like for yourself, if you know your triggers and for anxiety, I'm hoping like we will have some question where we can address that. So for anxiety, triggers are important, as well as your own coping skills. What is work, maybe like what is working for you not work for me. So you will know once you try. So try to find out those things. That can be the second step for you. Try to find out what is helping you to stay in a moment. And again, that is very important. As I mentioned, I gave very simple example. If you are at dinner with your friend, talking to them, so just talk to them. Don't look at phone. Don't like think about anything else, what you need to do next morning. Just enjoy that moment. And speaking of that, I would like to mention that, like every day, if you are anxious or not, everyone's life is stressful. If we are working or not working, if we are a student, even if we are on vacation, it can get stressful. Like we do have so many things on vacation. If you are like staying at home mom, even then, or like that's a lot of work still. Like you have so many responsibilities. So whatever is your situation, take out at least 10 minutes purely for yourself that day. In those 10 minutes, practice mindfulness. And mindfulness is very simple. It is not something big. We can go like, it can be like, uh, not complicated, I would say advanced. It can be advanced depending on person to person what we are addressing. But as simple as like taking out 10 minutes just for yourself, in which you don't have any for sure not phone, not social media, nothing. You can lay down on your bed and do nothing, just like relax yourself, just breathe in, look at the if you have like some beautiful painting in your room, just look at that. Or you can go outside. That is the big one. I really emphasize on going into the fresh air. Obviously, if it's like really cold in St. Louis, we have like really cold, or like until last week, it was like -8 or -6 something, or like in 10 or so, not in that weather, but overall, for 10 minutes, you can go outside, just breathe in, breathe out, look at the greenery. That all may sounds like stupid, like, just like looking, you are standing outside and looking at the greenery and trees, but that is powerful, trust me. It will make your mind fresh. It is mind blowing how those natural things can help you, especially with anxiety. So do those simple things. At least take out 10 minutes for yourself every day. I can keep going, but I'm trying to control myself and stop.
Questions. So, Pratir, if you can quickly ask your next question, and then Ayan has some questions which are related to financial anxiety and stuff. So, I would really like to ask those. Yeah, Pratir.
Okay, so thank you so much, Dr. Sitwat. My next question is about social anxiety and how do you overcome the fear of judgment and engage in social situations despite experiencing anxiety?
Okay. Yeah, judgment. So, yeah, judgment is very important. So, I would say, like, if we talk about like step by step, so first step should be to stop judging yourself. So, basically, what happened when we, so everyone has it. Like, some people has a lot more, but like some people are able to control, but we all feel the judgment by other. So, first step again, we need to stop judging ourselves. So, basically, what happens when we are an other person, like usually, like that's in our head more. Obviously, that can be questioned. People are like, oh, when you're starting a job, oh, you have not finished college yet. Or like when you are going to have babies, or like, it can be anything for person to person. So that is a judgment, or like, directly asking personal questions. So but still most of the judgment is basically in our head. So when we have a fear about like other people are judging us, basically first we are judging ourselves. We have like self doubts. Oh my god, I should do this because we all have like certain social criterias, like this should have done by this time, we should be earning money, blah blah blah. So these all things are already in our mind. So basically, like we have like some of the self doubts, or some people have like low self esteem. That's when it becomes more problem. So first, like, stop judging yourself and like find out the meaning of the judgment of that person. What does it mean to you? Does it make any change? Or like if someone is saying like, oh, you have not got the job yet, like you are still like jobless, so what does it mean to you? So basically, your situation. You are trying, or like even not trying, you don't want to do any job. Sure, like you are sitting at home. That's what you want. So know your priority. Then, like when any of the like people they judge you, so they say something, or you may think they have said this, or that's what they meant, or let's say they actually said something, or they judge you, and now like you are miserable. So what happens, they said that, then they walked away, they are gone. Now it's you who just keep thinking about it. Now you are miserable. Other person might be like enjoying, they're just like laughing with other person, they are like sleeping, having peaceful life. But here you are like miserable for yourself. So who is hurt at the end of the day? You. So you need to find out that. So with other people judgment, what does it mean to you? And what actually you are doing, if it is real. Let's say if it is real, you are failing classes and you are trying to finish that, but you are trying your best as far as you are doing what you need to do. So just keep going. That's the best thing we can do. Although these all what I'm talking about, those are like very easy to say and hard to do, but they all need practice, and they all are the part of the therapy. So they go through, like therapists can go through with you step by step with those feeling. If this is one of the big one for you, you are scared of that, like being judged, or like that makes you anxious, you are going through some stressful time, you have something in your plate, so they help you go through step by step processing those thoughts. So basically that's what therapy does. But what I mentioned, you can start practicing those in our day-to-day life to help ourselves. I hope that answered, but it is like little bit different, difficult one, because again, like you can try, you can practice, but sometimes it is hard because it is, it is easy said than done. So, but yeah, that's how it is. We need to find out the actual meaning of that, and first we need to stop judging ourselves. Okay.
Yeah, Ayan, you have your questions.
Yeah, thank you so much for the informative presentation. Another question we had was, how can individuals practically manage and reduce their financial anxiety through some practical steps that they can take, especially when they're, facing some uncertainties or challenges in their financial lives?
Okay. So yeah, thank you for the question. Those are some very good questions, I would say. Great questions, in fact, and very important. So basically, financial anxiety. So that is something like, it is there. If you are going through some financial problem, it can be one part time in life, or it can expand over like multiple years. So that is basically a fear, I would say. It is there, like you are actually experiencing it. So for that, I would say, like, from just like face the fear. It is like facing the fear. This is one of the big part of therapy we do in so many, for so many different psychiatric, even illness, not even like for the main day-to-day life thing. So face the fear. What does it mean? If you actually have something, so I would go, like, with the same example. If you actually see lion is there, now you will run away. You will try to do something about it. You will try to save yourself, or you will, like, try to defend yourself. So same way, face the fear. So, and then, like, obviously, if you are going through financial problems, first face the fear, find out it is there, address it, like look into the eyes of that, like, and deal with it and find out what you can do next. Another important thing is find out what you need and what do you want. That is one of the big thing most of us struggle. There are basic necessities or basic needs we all need, like shelter, food, clothes. Those are the basic necessities. Those all we need. And then there is a thing we call, what do we want? Sure, like we want, good things. We enjoy things. We want to do a lot of shopping, or we want some, like, nice house, nice car, nice clothes. So those all are like we want. So when we are going through financial problems, so we need to find out what we actually need and what do we want. And if we start prioritizing things, like basic things which we actually need, or which we actually need in that time. Let's say you need two or three different things, but what you need to do is, like, right now you have to pay your one of the bill. Otherwise, like, they will, like, you will not have that anymore. Or you have to pay your semester bill, semester fees, and that is the big one. So you can keep, like, other stuff and your list later. So if we start prioritizing things, that's usually helpful. And obviously, I'm sure if you are going through financial struggle or financial problem, you are trying to improve it. You are trying to find a job, or find a better job, or find, like, some other resources to get better income. Or if like, you are still studying, like, this much, 1 year is still left, so there is something coming up, so you can look forward to it. So obviously, working hard is basic, like I even don't have to mention. So when you are going through financial problem, face the fear, find out, like, the basics, or like what do you need or what do you want, prioritize things basically, and then keep working hard. And then do take care of yourself by all of the basic things which we discussed. So taking care of yourself is very important in all of those situations. While, like, it is judgment, it is like a financial problem, taking care of yourself is the most important. If you are good, if you are doing good, you are able to take care of yourself, you are able to take care of everything. If you are in good mental health, in good physical health, everything is possible. You can make things happen. But if because of financial problem, being judged, any anxiety, anything else, now it is affecting you, then everything is just gone. Everything is zero. Everything is useless. So, yeah, I hope I tried my best to answer this question.
Thank you. Thank you so much. We have one more question. How do you believe a better understanding of the root causes of anxiety can contribute to more effective coping mechanisms, particularly from uh, particularly in the context of family dynamics or relationships?
Oh, okay. Yeah, that is also very important. Um, so, yeah, so basically, like I would say, so knowing or understanding about the situation is exactly what cognitive behavioral therapy basis is. So, what it is, cognitive behavioral therapy, as name tells you, cognition meaning understanding what we are understanding about the situation or anything, what our understanding is. Because, same thing, I may take it differently, you may take it differently. So, what is your cognition about the situation? And then behavior, meaning how you are responding to that. Something may be pleasant for me, but it is like very anxiety provoking or disrespectful for other person. So, and I may respond like pleasantly, but other person may get upset with that situation. So cognition meaning our understanding, behavior meaning how we respond to that. And like then therapy basically involves changing your negative cognition or negative thoughts into positive one. So when those negative thoughts come and you perceive it differently, so you now better understand, and behavior meaning now you respond it to positively. So that is the understanding. So this sounds like abstract from like what the question is, but what I'm trying to say here. So this question is directly related to, that's why I mentioned like very good question. It is directly related to the basis of it. So basically you need to understand. So now coming to the point of like your family dynamics or like relationship. So you need to understand the situation, then you need to find out the triggers. That works very well because we see people a lot, like all of the time, with relationship problems, family dynamics, like they are having hard time because house or your home is the first place where problem can start. You can deal with like outside problems with friends, with even work, but that is the hardest if you have problems inside the house. So for that, understand everything, like, learn about the situation, learn about yourself, find out your triggers. So that can affect, like, your cognition. So this is your trigger, or which can be like some person in your relationship, like your family, or like people who you cannot avoid, like they are there. So those can be trigger. So, figure out those triggers and then respond to that, or like find out your ways how you can do better. Because if there is some trigger, some conflict going on in relationship, or there is some family dynamic which you really don't like, it is there, it's a fact. You cannot change that part, but you can change how you react or what you do about it. So you can either like burst out, or like being angry, or like shout on that person or on that situation, negative situation. You can do that, you have that option, and many times we do. But you have other option also, like just walk out, like stay away, or that person is there or that problem is there. So you cannot change that, but we can change ourselves, which is still very hard to change ourselves. It is still not very easy. So find out your trigger, and then like how you respond. You can walk out, you can like do something about it, or if like this is just there, the part of it, like, so then like take it as it is unless it is like hurting you in any other ways. I'm not saying just like be patient and deal with it. That's not what I mean. meaning you need to do something which helps you, which does not make you anxious or make like really irritable or angry. So that's the point here, to control yourself. I hope it was helpful.
Yeah. Yeah, so I know we are right on time. To sit with just one quick question, and then we have several questions which we received. We're probably going to request you for more time for another session at another day. So one quick thing is about, someone has asked that people have found this treatments for anxiety and for example, getting counseling, professional help, it's very expensive. So is there anything, I know you did share mindfulness, yoga, meditation, taking magnesium lavender. So all these are my notes. Probably I hope others are also taking those notes. Anything you can suggest as far as therapy or any free of charges online resources where folks can help? Can you share something around that?
Yeah, that is definitely very important one, and I totally get it. It is very expensive most of the time, but again, like there are some ways. I would say like it depends on like what can work for someone. So one is like EAP, Employee Assistant Program, that is available very commonly for most of the people and most of the workplaces. It is available. Even for part-time employees, full-time employees, but most of the people, unfortunately, they even don't know about that. So I very commonly recommend most of my patients to look into it if they have that available. Most of the places they give you like about, it depends like on again like part to part, but anything between 8 to 12 sessions free of cost. So you can learn during those sessions, and then you can apply or like keep applying in your daily life later. EAP is one of the big one. Then therapy, like there are different, like, so now since COVID, we have a lot more options, which are available online. So it involves a state license. If you are going for formal therapy or formal psychiatric treatment, they need to have that state license. So it is specific for state to state. So you can look into your state. You don't even have to look into your area, or you can find therapists who can work for, like, let's say if it is like Texas, or like it is like Illinois or whatever. So you can look into those, like whatever online therapists are available. Some of the therapists, they offer you like kind of package. You can go with that, like they give you like some discounted package if you get like a specific number of sessions. Then there are some options for which, like what I wanted to mention, there is another for therapy. um, which one is that? Yeah, let me see. Yeah, for insurance, I wanted to mention. So if you have health insurance, it may sounds like overall expensive to you, but in last few years, laws are like a lot better for mental health treatment. Earlier, there was like less portion, like insurance would cover your medical problem, diabetes, asthma, but they would not cover any of the mental health problem that include a psychiatric visit as well as therapy. So now they are covering a lot more. So check with your insurance also what they have to offer. Through insurance, many times you don't have to pay anything. That is one of the good option. Plus, if you are on high deductible, then you may still have to pay, but it is like very less amount out of pocket. So that is another option. But still, that does not still address all of those people who do not have any type of insurance. So I would say like it is not very strongly recommended if you actually have a problem. What all I mentioned, those are for like early day to day basis if you are anxious, or you can still try those things first, but still, like, if you get some help but you still feel like it needs to be better, then you definitely need to get professional help. I would say do not suffer, because you keep wasting your time if you are suffering, and like you lose years of your life, because people with anxiety, when they get better, they tell, this is very commonly heard, like I commonly hear it with so many people. They're in their 30s or 40s, they tell me that, like, oh my god, now I can feel, which I can say like maybe normal people feel. I never knew you can feel this good, or you can feel calm, or you can feel better, because they have lived with their anxiety for their whole life, which is so sad. That makes me sad, because of the stigma. People don't get treatment. Stigma can be the whole another topic, and I really want to address that. But we have a stigma, but I would say don't look at any other people. Don't think what people say or do, or you are suffering, right? When you have anxiety, when you have depression, when you have any problem, financial problem, it's you who are going through with it. If you have like a lot of money, you are enjoying that. Other person, like, they may see like it as a, like, glamorous thing or something, but it has nothing to do with other person. So same with, like, if you are suffering, you are suffering. So take care of yourself. Don't worry about anyone else. And mental illness, anxiety, like if you're going for therapy or you are seeing psychiatrist, it is like just like any other medical problem, diabetes, asthma. So these all mental illness are the problem of the brain. So do take care of yourself. Do get attention. So I know this is not related to the question, but I did not, I cannot stop myself mentioning that. So again, I one more point about the question is, so if like it is like you cannot get the formal treatment, or like the actual like professional treatment because of the money problem, so then try all of those, like which I just mentioned. And like if you have like any, I can send some more resources. If someone wants, you can, like, approach Aisha, and I'm happy to send some of the reliable resources which you can practice, even online, which you can try, like, what all therapy techniques you can use, like some of the, like, meditation. Like I can send like some of the YouTube videos which can be like a little bit more reliable. We can search Google, there is like Dr. Google, which has so many resources, but all of those resources are not trustworthy. So I wouldn't just like try something random without like finding it if it is like reliable. So try that, like do initial things which we just talked about today, then do a little bit more by searching, then like look for EAP, then look for like if your insurance is covering. So try your best. And even if like you have to spend some money to get therapy or like get into it, I would say self-care is the most important. Do it so you can like earn more money later for yourself. You don't need to be in therapy or take medication or seeing psychiatrist for your whole life. You can get better, not always. Sometime, some chronic problem, sure, you have to take treatment for your whole life, but not always.
Thank
That's the
you
best I
so
can
much.
say.
Yeah, thank you so much. You gave us a whole bunch of information, all useful information. We have taken notes. We have some more questions, but since we are on time, a little bit over time actually.
Over time.
And thanks for a little late. We appreciate you staying late, sharing your knowledge, and answering all those important questions with all the plethora of information which we're going to leverage from. Thank you. Thanks everyone for joining us today. Thank you until we meet again. Allah
Yeah,
Hafiz.
it's my pleasure. It's my pleasure to be here. And thank you, everyone. Thank you, Aisha.